Hey everyone, Rex here. Before we get to the episode where we have a great discussion with the author of this fantastic book, I want to talk quickly about our collaboration with Rise in season 1 and something that's coming up. So, as you probably know, Rise National is having its 20th anniversary this year, March 23rd to the 25th. It's the only Medicare Advantage event that brings every operational discipline together under one roof. 1,600 plus leaders in the room. Direct updates from OIG, DOJ, NCQA, plus an NBA Hall of Famer is keynoting this year. It's at the Orlando World Center Marriott. If Medicare Advantage is part of your job, this is the place to be. Use code BEYONDVIP to save 20% on registration. Sign up at risehealth.org. Now, on to the show. Quality improvement in healthcare. It's typically described as a framework for systematically improving care. In reality, it's an endless struggle to align policy, data, and processes with human behavior. Join the RWC team and guests from across the industry as we tackle the toughest challenges facing quality today. From culture to capital, from strategy to technology, join us as we go beyond quality. Hey everyone, welcome back to Beyond Quality. As you heard in the intro, our objective here is to really have compelling and thought-provoking conversations around the things that drive quality, healthcare quality specifically. So from culture to capital, from strategy to technology, and kind of everything around and in between those things. I'm your host, Rex. I lead RWC, a healthcare quality improvement organization. And today we're going to dive into the concept of leveraging quality as the guiding strategy for the entire organization. My co-host today is Ryan Bernstein, Senior Consultant and Medicare Lead at RWC and facilitator of Stars Council, which is a mastermind-style community of Medicare Star Ratings enthusiasts from all around the country. Ryan earned his stripes as a research analyst before diving into Stars Analytics and then Stars Strategy. And our guest today is Dave Williams, an improvement scientist and advisor who co-wrote the book Quality as an Organizational Strategy, which we're going to dive into quite a bit today. So Ryan and Dave, welcome to Beyond Quality. Thanks for being here.
Thanks, Rex.
Good to see you.
Yeah, you too. Hey, can each of you give a little more of your story so our listeners can learn more about kind of why this topic matters to you? Ryan, can you start?
Yeah, for sure. So, hey everyone, excited to be here today. As Rex mentioned, I kind of started my career in the quality space as a data analyst, supporting hospital research at Boston Medical Center. From there, after earning my master's in biostatistics and epidemiology, moved into quality analytics, which is a space, as we all know, sucks you into a deep dark hole that you can't get out of, but it's a hole that we love. So kind of from there expanded my scope into strategy. As Rex mentioned, worked at a health plan as a Medicare Star Ratings leader for 5 years before joining the team at RWC in July of 2023. Since then, have just really enjoyed diving into many of your organizations to help promote quality strategy and engagement with our members that we serve in Medicare Advantage.
Great. Thanks, Ryan. And how about you, Dave?
Great. Thanks, Rex. Well, hi, my name is Dave Williams, and I'm an improvement advisor. I'm based in Austin, Texas. I got my start in quality 26 years ago when I became the chief quality officer for a major metropolitan ambulance service. And I had studied quality improvement in my graduate work. I ended up working initially in the ambulance space, and then I moved over into healthcare when I started working as an improvement advisor, supporting programs and projects for the Institute for Healthcare Improvement. I spent 5 years on the leadership team there as the senior lead of improvement science and methods and leadership for all the global programming. And now I'm an independent improvement advisor. Most of my work today, as Rex mentioned, is centered around kind of moving from taking process improvement at the project-based level and starting to think about how do you apply some of the concepts of the science of improvement and a series of activities across an entire organization organization so that you can leverage the same ideas and theories that go into process-based improvement to organization-wide improvement at the leadership level.
Thanks.
I love that.
Yeah, thanks, Dave. And real quick on background, I got introduced to Dave by taking a Harvard X online course around improvement science, and was impressed with the theories and the way he practiced and taught on there with some other people like Don Berwick. It was a great course, and just got really enamored with the more, I guess, rigorous thought of improvement science, right? Something that I think a lot of us in quality improvement maybe don't leverage enough, right? So really excited to dig in today.
Awesome. Yeah, one of the most intriguing ideas I think in your book and kind of overall philosophy, Dave, is this idea of organizations of systems, which we've referred to a little bit up to this point, and that those systems are responsible for processes. You talk about kind of an organization's approach to process improvement, but what I think we want to talk about today is how to shift to system improvement. Within that, I think about organizations as layers of systems potentially, and that each of those systems are responsible for their individual processes. I think one of the clear concepts that is clear in what you talk through is that the benefit of zooming out from those individual processes and systems to seeing the bigger picture is what most enterprises are missing. So can you talk about that balance between organizational level system versus those more granular things that we're more used to talking about in process and quality improvement?
Sure. Well, I mean, as you already mentioned, one of the terms is process improvement, right? So an underlying theory of improvement is that most of our work can be described as a process, and part of our job is trying to figure out, well, how do we create a reliable process that gets outcome that we want, right? And in most improvement work, that's what we would call project-based improvement. There's a particular metric or outcome that you're trying to achieve. There's a series of steps or things that come together in order to achieve that outcome. And so a project, if the process that you have isn't getting the results that you want, project is created to work on that. And that is the heart and soul of improvement, quality improvement. Now, as you mentioned, if you think about any particular process in an area of an organization, they don't operate in isolation, right? So in any space in any department or any unit in a hospital or department in a health plan, or even if you go to your favorite fast food restaurant, all of them have multiple different processes that are working together. And what you're describing is that there's a recognition that not only do I have to have each individual process working, but they got to work in synergy. They got to work with the ones that they're linked to and interacting in. And sometimes people think about this as what's called microsystems, right? So you start to look at the space around where things get done, and then start to ask, like, what are all the various people and equipment and processes that are involved in there, and how do I work on that? And that is like the layer up from thinking about just one process, right? So there's the process, then you go to something that is that micro system or that frontline set of systems of processes, and then you can start to pan out from there. And so it's almost like the best way that I can describe it, the way we think about it in the book, is it's like if you think about Google Maps, and when you pinch in or pinch out, right? So you could start, and you've probably seen this online, where somebody starts with a real macro level view of the world, and they can see all the continents, right? And then you can pinch in and you can come to the United States, and then you can pinch in and then you can see the 50 states, and then you can pinch in and you can look at where I am in Texas, and then you can pinch in and come to Austin, and then you can pinch in and you're in my neighborhood, right? So systems operate in the same way. The process is like looking at the street level on the map, and then each layer up pans you out and helps you to see where that particular element is in relationship to. And so, in an organization, you pan out from a process to the processes that are in an area. When you get to an area or a department, you might start looking at how they're connected to other parts of the hospital or other departments within the system, and then eventually you get up to the whole organization.
I love that kind of this concept of zooming in and out as needed. I think about some of the pitfalls when we don't do that sort of thing. A lot of the work that we support with our base of clients is around this gathering of cross-functional teams, entities to accomplish one big thing, right? And a lot of times those teams work in silos where, an improvement initiative is happening to, better an outcome on this side of the house, while there's also this element that could improve outcomes over here. I think about a concrete example, controlling blood pressure on the medical side versus adherence to medications on the pharmacy side, right? Like a lot of times those two things are happening in silo of each other, but if you were to zoom out and see how those processes interlink and ultimately how they synergistically can improve outcomes, that's how I think about what you're describing. Is that right?
It is. I mean, one thing to appreciate is that any system, not all the parts aren't equal. And there actually may be some fluctuation about like which parts get more attention or less attention at various points, depending on what you're trying to do, right? So one of the problems when we break things down into all their parts and then we try to treat them all as equal and we try to get them all perfect, often we do that in isolation. We don't think about how they work together. Right. And so I can create a perfect process here, or my colleague in pharmacy can create a perfect process over there. And then, maybe there's a third person that's processing claims that gets a process over there. They're all related, but they never thought about each other and how they're connected. And so now you have three processes that are perfect in isolation, but not as a system of things that have to work together. And so sometimes you have to understand like the full sort of flow of the various processes and how they're going to fit together. And then ask, what does one need to do to support the other, and how do they hand off to each other? And that has to, that's more than just, us communicating with each other in our silos and then saying, here's how I think, here's how you think. Now we better understand. It's actually defining and saying, well, if you do this, this is what needs to be on the outside so that I can take it and do my part and build upon it. And how do we work together as this synergy where things are at their proper potential for what's needed at the time.
Totally.
Are there certain tools, or when you're helping an organization understand those interdependencies, to help an organization, because they're used to looking at, like Ryan was saying, and this is like, you've got some good visuals in the book, going from the framework of an org chart with silos to this system with these interdependencies and microsystems. How do you help organizations appreciate and really understand those interdependencies that you're talking about? Are there visuals? Are there certain tools that you leverage in those cases?
Yeah, so you described already, when you go to an organization and say, well, is there, what would you use to show me how your organization is created or works? Very, very commonly, somebody will present you with an organizational chart. They may even have it on their website. And an organizational chart is a visual display of the accountability of roles within an organization. It doesn't tell you anything about how work gets done, or who does what, or how much of what. It's really who's over certain elements of the organization. And those may be service lines, they may be departments, they may be full activities, right? So that's not as useful. Now, going back, when we were talking about work, all of our work can be described as a process. So obviously, one of the elements that's really helpful for us to have a conversation about how things get done is to use something simple like a good old process flow diagram that helps us to walk through like what are the steps of the process, whether that's the imagined steps of what we think it is, or actually following like claims through a process, or a patient through the pharmacy to see like what it's like in practice. But but that helps us to understand like the way that work is. Now you mentioned, a bigger picture view, which is to think about like a system map. And that's where we used to call it a linkage of processes. That's where you take all the different processes in a space, and then you show their interdependence. Like you connect the dots and say like this one, when this process ends, it moves over to this one, and you could show the relationship and how they're linked together and how they move together. And that's one of the tools that we bring when we're talking to organizations is how do you understand all of the processes that are in a particular space or in the organization as a whole and how they're linked together. And then the second thing that's tied into understanding the system is having a set of measures, a vector. We call them a vector of measures because it's more than one. Usually, it's a dozen or more measures that are interrelated that tell us about different things. Maybe they tell us about the key outcomes of that area or the organization. Maybe they tell us about key things that are tied to your purpose. Maybe it's very specific things that have to happen successfully. But we display those visually in a time series chart like a run chart or a Shewhart statistical process control chart. And together, the system map is kind of showing this is how we work. And the data is showing it's like the vital signs of the process and the system that says, and this is what happens. And so together, those really help us to learn because we can now, with a process map, we can talk about how we think work happens or how we've observed work happens. When we pan out and look at multiple processes, we can look at the system map and see how those are all linked together. And then we can bring in our vital signs of the data and look at time series charts together so we can see, oh gosh, well, here's the current sort of outputs or outcomes, I should say, of those processes and how they work together. And when I make a change in the system, here's where I can see whether it's actually moving in the direction of goodness or not. And I can also be able to determine where in the system I need to work, like which stuff is achieving the goals that I want, which is not. Is it a stable process that is built that way and I just don't like it and I need to change it to improve it? Or is it unstable one? It's one that actually is chaotic and isn't predictable enough that I can even worry about improving it yet. I just got to stabilize it first and get it to some degree of order before I can worry about whether I like it or not. And so those tools, the flow diagram and then panning out to the system map and using a vector of measures of time series data that's tied to that stuff as a feedback mechanism is really helpful.
I love the way you talk about those signals, right? Like the things that tell us when things are going wrong. And presumably things could go wrong with the system, right? Maybe upstream kind of structurally. And then things could go wrong with a process. When I think about improvement, sometimes people will try to tackle the system itself, and sometimes people will drill down micro and try to tackle the individual processes. We've talked about that a little bit. I think one faux pas that organizations make when they talk about this zoom out and look at the system as a whole is that they might translate that to the need of large efforts of improvement, right? Like an entire organizational shift or a huge project that costs a big bucket of money, right? And I think one of the points that you make is that improvement, we should think about it as a muscle to get trained, both in identifying the areas that need improvement that we were talking about, either systems or processes, but also in the actual effort of improvement. When I think about building a muscle, I'm not going to start by bench pressing 500 pounds, right? I'm not going to start with the organizational overhaul. I'm going to start with maybe a pair of light dumbbells, right? And so how can you help us think about, these huge improvement efforts within the context of a system and how to get there by building the small improvement muscle?
Yeah. Well, one thing to think about in organizations, leaders, when they're uncomfortable with the current performance of something, often look to change to get a different result. Right, so there's two challenges that you can run into. Right, one is that you assume that the way things are working are just fine, and my attention should go on just sort of pushing harder on people, or maybe using incentives, or maybe it's an educational problem. So there I make an assumption that the system I have actually is good enough, and there's something else that's wrong. There's some misalignment, and that's really
Is that ever the
common.
case?
Actually, a lot of times when the system that you have, well, it's perfectly designed to get the results that you get, right? So that's an old saying that's been used around healthcare for a long time, popularized by Paul Batalden at Dartmouth, that actually came from a book, but it's true. So any system that you look at is built to get the results that it gets. And one of the first questions, like we were talking about before, is do I have something that is stable and predictable, or do I not? And that should be the first question that anybody should ask is, because if I have a system that is predictable, like I don't like the results, but if I don't do anything, I know it'll be this way next month or next week, then that's useful, because that helps me know that if I want a different result, I've got to change the way we work in some fashion, right? If it's unpredictable, if the data, every time I look at it is going in different directions or has weird patterns, or I can't make a guess as to what's going to happen next time, then I got to figure out how to get it stable. And often means we've got to go back to the fundamentals. We've got to figure out, like, how do we create a shared way in which we work together on a particular process. And it doesn't have to be perfect. It just has to be similar. The way I often describe it is it's like cruise control in your car. If you drive, I don't know if you use cruise control, but this is a great way to learn about variation, is to get on the highway, not necessarily in rush hour, go in a time where traffic's moving somewhat, and put yourself in the fast lane, and then set your car for a set speed. Do something like, so let's say it's 65 miles an hour, maybe go 68 and set your cruise control there, and then watch what happens. And it's rather fascinating. If you've ever done a road trip like this, you've probably had this experience. But all of a sudden, you'll see that cars will pass you. And then if you do nothing, in a minute or two, they'll start falling back and you'll pass them. And then without you, you're a constant. You've established yourself as a constant, but all of a sudden you'll watch people pass you, and then you'll pass them, and there'll be all this, or somebody will whip by you, and then 5 minutes later you'll pass them. And what ends up happening is by creating yourself as a stable constant, you're now able to see all the variation around you. Whereas when you were driving like everybody else, you were constantly adjusting your speed in relation to the other cars. So you didn't notice all the variation that existed. But when you stabilized yourself, when you said, we're going to, you basically create standard work or follow a standard process, that enabled you to see all the noise that wasn't obvious to you before, because you became constant. So in the case of process improvement, that's one of the first things I always ask is, what's your process? And if you have one, let's try to use it. There's a good chance you're not using it. So it's really actually interesting to try your process as it's written and see what happens. And that actually stabilizes work. It takes away some of the noise, and you'll almost instantly identify that there are things that need to be changed, right? And then if the system that you have and the process that you have is not working where you want it, then that's a great place to start thinking about, how do I change the system I have to get to a different result, right? And so that's tied to that idea of stable, getting to a different result. Now, the hard part is a lot of times people decide to just do big switches. So they don't know how the system works that they have. They don't like it. And so they're going to switch and do a totally different thing because they just hope something better will happen.
Right. Totally. And we see that, time and time again. I think one of the things that keeps organizations from making those small changes or from following a process is that they don't have the evaluation structure in place to know whether or not something is working or whether or not that thing is the thing that is or is not creating the results that they want. So as we talk about implementing these processes or following along a process trajectory, how do you recommend people thinking about the evaluation of that process? Is it within the framework of those vectors that you talked about before?
So vector tends to be a little bit higher level, but the measures that go into the vector come out of things that matter, and it could be a process. And so when you're developing a process, all the way along the line, there are things that you might decide are important to that process that need to happen every time in order for the process to be successful, right? We'll call those quality characteristics. So even though there might be multiple steps, there may be key things. Data has to be captured, has to be entered in a certain way. Maybe you need to get an approval before you, refer somebody to do an appointment. There's all kinds of things like that that are key in order for the process to be successful. So one challenge is that frequently people create a process without actually testing to see whether that process works and gets the result you want. So part of process improvement is you're working to design a process that gets the outcomes that you want. And to do a project, or whether it's designing it or redesigning one that you have to get a better result, you need to both have a sense of what the work is, and what are the key things that have to happen. And then you're going to develop specific measures that help you to understand whether those things are happening. So, in healthcare, a lot of times those are we call them process measures, right? They're measures of specific things in the process that have to happen in order for you to have the outcome of the process, or the outcome measure work. And so a fully matured process is one that not only is a process that achieves the outcome that you want, sure, but also is accompanied by measures that are showing that it reliably does that. And so if you look at a process and somebody says, I don't know how it works, or I'm not getting the outcome I want, but I don't know whether it's working or not, they don't have a fully matured process. They may have a protocol that they've written down. They may have something that they trained on, or that they laminated and put on the wall, and they say, I want you to do this, but they may or may not know whether it actually works or not. And so many times they're working on trying to assure compliance to it, and they're getting frustrated, and they're seeing that as a people problem, and they have no idea actually whether it works, right?
Totally. I think that's a problem we run into time and time again, is like, we think that this thing is going to work, right? Like we might even have evidence that the thing is going to work, but we don't know for sure if it works with our population, or if it works in the exact idiosyncratic way that we're accomplishing it, right? So in that evaluation step of process linked to outcome, what steps might you take to ensure every step of the way that we're getting to that mature process state?
So usually I don't install a process permanently until I've tested it, right? So I want to know that it works. Because if I install it and it doesn't work, I'll feel the pain. So I'll give you a good example. This is a non-healthcare example, but it's a beautiful one right now that sort of illustrates this. You may have followed, I'm sure you all have flown Southwest Airlines. I believe it was about a month ago, Southwest eliminated its long-standing process for boarding planes, where you used to kind of run for your seat and no assigned seats, and you'd line up and do all that stuff. They've been doing that for decades, right? Now Southwest had the fastest turnaround time in the industry early on. That was one of the things that helped them grow, and they were amazing at it. But long reasons why, but in today's market and in their growth, they learned that they needed to change, and they decided that they were going to get into this boarding process. Now, if you've been following the news, they are having a lot of trouble with this boarding process. And it's weird, because you're like, well, everybody does it this way, so why would it be so hard for Southwest, who are really good at process, to make this switch? And part of it is that they I know that they must have tested it to some degree, but when they moved from their small testing that seemed to work to full scale, they're discovering all kinds of things that they didn't pick up on initially. things about like where the crew keeps their bags,
Yeah.
how they also turned off free bags, so that means fewer people are checking bags, and they're actually bringing bags on board, which means there's more bags than they had before. So they changed two significant things at the same time without really looking at what that meant together, right? They also price tiered their seats. So whereas I would run for the nearest aisle seat, or maybe I'd look for the exit row and then run to the nearest aisle seat, and that was my method. And other people would go to the front or the back. They had all kinds of theories. Now it's price locked. So that means that a good chunk of us who are cheap go to the back of the plane, right? I was on a plane the other day, and there was nobody in the exit rows. They had to move people into the exit rows because nobody bought them because they were expensive. Whereas they used to be the prime seats that filled first with all the business travelers, right? So anyway, so this is a good example though where they made a change. It probably seemed like very common sense, and I know they tested it because that's just Southwest way. But they are grappling with a whole host of system issues because they went to full scale without fully appreciating all the ins and outs of what was going on. And most of these could have been predictable, and they're going to suffer some consequences of inefficiency and customer friction and things like that, and bad media for a while until they figure it out. And I'm sure they will, but it's a good example of where something that seems like it's so common sense, everybody else does it, I should just be able to flip a switch, it shouldn't be that hard, actually creates some significant issues because you didn't test it enough to figure out what are the issues to make sure it worked.
Yeah. So yeah, you gotta test it. And I think in our world, right, so many organizations focus on these things that are measures, but not necessarily measuring, and kind of where you're going with some of this, Dave. And one more point I want to make, and I don't want our listeners to miss this key point. And we're talking all about it, but really succinctly from the book, you say, or it's said in the book, you describe certain distinct ways to make improvements, right? So I think there are 5 in the book, but the 2 that really jumped out at me are, number 1, to design something new, or number 2, to redesign something that exists, right? And there are some other things too, but the point here is, and you make this point in the book, all improvement requires a change. So the system has to be disrupted, right? Would you say that? I think, and you started off the conversation by saying something like, a lot of people think that their system is good. They just gotta, motivate their people more, or give some incentives to the patients or to the doctors or whatever. But they're not really making a significant change to the actual system or the process. But would you say every improvement requires a disruption to the system?
There's some level of disruption. So when you hear the word disruption, sometimes people think it's very significant or chaotic. That may not be the case, but I like what you described, which is that in order to get a different result, we have to do something different. And there's often 2 things in there. There's more than these 2, but these are kind of the 2 common ones. And one is, we don't have a method or a way of doing what we need to do in order to get to the outcome. So we've got to create something. We've got to design it. And that's starting from scratch. That's trying to say, I'm going to do a whole new process. So a lot of people are doing that now, for example, with trying to figure out where AI fits into their world, right? It's new. They've got to figure out how to design it or pull it in. The other is the most common, which is more redesign. So I'm looking at a process, and I have something, it's supposed to work, but when I look at it, either it's inconsistent or there's certain populations that it's inconsistent in, and so I need to figure that out, and then figure out what do I need to do to redesign that process so that it works in a better way.
Well, that I think what we're talking a little about is innovation versus new ideas, right? And I think within that context as well, like the types of changes that we make matter. I want to talk a little bit about another point in your book around this concept of planning. when we make change or disruption, we have to plan it first, right? I've got a 5-year-old, and he um, likes to build things, but he doesn't go in with a plan. So he just starts building and sees what he gets at the end and then tries to say that it was his vision all along. We talked about setting a vision before we start. We tried building a treehouse this weekend, didn't go great. Um, so I want to talk about this planning concept, and that there's two types of planning that you talk about in your book. One is planning to operate, and one is planning to improve. Can you talk about how vision works into that? What steps are required for each of those types of planning, and what type of results you can expect um, after both of those types of planning are implemented?
Okay. Yeah. So one thing to think about, a key component or key activity for leaders when they're thinking about quality as a strategy is like, what is your purpose? And tied into that is the vision and the mission and the tenets or the practical values that you use as the way that you work, right? So a vision is thinking far out into the future and saying, where do we aspire to be? What's the where do we want our organization to finally achieve? And a purpose or a mission is typically a little bit more specific and clear, where it explains like what's the need in the world that you fulfill with your services, and how do we build a system, right? Going back to talking about systems and system maps and vectors and measures, how do we build a system that gets that serves that purpose, right? Meets the need of people that have it. So, it could be, for example, I'm an insurance provider, and I provide insurance to individuals, and they have a need to be able to seamlessly get healthcare, whether that's preventatively or it's in an emergent space. And so everything that I do has to be built in order to enable that. And then I also may have some risk elements that I'm paying attention to, right? So that is, helps us kind of to be clear about the direction we're going in, and then that we build the system to get there. Now, one of the things that happens there is that there's a good chance we're not going to build the perfect system right out of the gate, right? Even if we started our organization from scratch, we're going to start with our best guess and our best theory, and maybe build on the shoulders of others and best practice and kind of have it laid there. But if we want to truly kind of be an organization that's better at getting better, we got to figure out each year, how do we get better and move our organization closer and closer towards making our services better matches for that need that our customers have or our clients have, right? So that's where planning comes in. And so one of the elements of quality as an organizational strategy is to, on a regular basis, and for most organizations that might be every year, there's some kind of a formal process in which you take in a bunch of information about your organization and your market research and what else is going on in the world, and you pull that together in an organized way and analyze that information and bring it to all the stakeholders that are going to be involved in a planning process, and you use that as a way to look at what are the strategic priorities or the strategic objectives that we need to try to approach this year. Almost every organization has a list of strategic priorities that they've created through some kind of process, right? But in planning, what I want to do is, one, I want to take this information in and ask, are these the right things, right? Are these the things that we truly, all our insights and data and information tell us this is what we should be working on? And then the second thing is, I need to then go back and ask, well, if I want to keep making progress on these, if I want to keep chipping away and making a difference here, where do we need to work? Like, where do we need to either change things in the organization or do more of what we're doing today in the organization, right? And that's where improvement in operating comes in. So we actually have a pretty detailed process that we share with people about how to do planning, and one of them is to take those strategic priorities or objectives and actually go back to your system and say, well, where would I have to make improvement in order to make a move in the direction of these priorities. And if I made improvement on this process or this area or these processes together, what measure is going to move, what dots are going to move in the direction of goodness on my vector of measures as a result of that, right? And so I'm actually relating the things that I want to do to where I need to do it and what outcomes that are going to move if I do them, right? So that's part of the planning to operate piece is identifying what needs to get done. And then if those are things that are, going back to what Rex was saying, either something that I need to create because I don't have it, I need a new process or a new service, then I got to design that. And that's a style of improvement. If it's something that I have, but it's not performing to the level that I want, and I've got to change that system to get a different result, I got to redesign it. That's an improvement project, right? So those are things that fall in the improvement side. The other side is a part that often gets forgotten. It's part of typical business processes, but sometimes you identify that you need to do stuff, but it's not a change as much as you just need to resource something. Right. Sure. So maybe you evaluated a program where you use text messaging to remind people to go to their appointment. And you discovered this is awesome. It works really well, but we've only been using it in diabetic patients, and now we also want to use it in cardiac patients and patients with kidney disease. And so we need to expand it. So we're not creating something new, and we're not changing the way that we work, but we're saying that we need to invest more in something that we've decided we work. That's a plan to operate, right? That's a budget decision. It's not really a change of the system. It's just saying we want to fund more. Or let's say that you decide that you educated staff on something and it was really powerful. It worked really well. You saw a good impact on it, and now you need to either refresh on that training or you need to expand that training to other people. Again, that's a budgeting, resourcing type of question. That's an operating question. So in the operating side, you're basically looking at what you're doing and saying, well, how do I budget and find it, create the resources for the stuff that worked? And if there's stuff that we need to infuse more into in order to continue to make it work or to expand its potential, then that's a plan to operate. It goes into other business processes, but it's different than I actually have to create something new or I have to change the way that we work. And so they come out of the same process. The same planning process will help us go improvement stuff, operating stuff. We got to do something about this. But they're different mindsets in terms of how we have to activate those as leaders and managers.
And related to that planning, when you're planning a new intervention, there's like we subscribe to the belief, I definitely do, that quality improvement is data driven, but it's human dependent, right? Largely. So when we're building something new, it's dependent upon the humans. So something you bring out in the book is you say, one common mistake is to think of change as only a technical issue. There is no such thing as a technical change without a social effect. And I think Duran said this, right? So can you unpack that and help listeners understand what social effect means and how they plan for that?
Yeah. So that quote actually comes from Marvin Weisbord, who wrote a great book called Productive Workplaces. So the idea, there's an old model called socio-technical systems, right? And Marvin was big in organization development and human behavior. And so sometimes, especially if you think like manufacturing or if you think about software, we create technical process or systems that operate in a certain way, right? Or that should operate that way. Southwest, I'm sure, modeled that process and did it somewhere in Dallas. They probably have some facility where they got people together to volunteer to pretend to get on planes and things like that. There's a technical element, and probably on paper it's fantastic. And then there's a human element, of which, as you mentioned, Rex, I like to say, especially in human systems, like improvement would be easy if it weren't for all the people involved, right?
Right.
Because it's easy to write steps and say this is the way something should work and create measures, but it's a lot harder when you have different people that come from different backgrounds, have different experiences, have different motivations, may have different limitations, and so or ways in which they operate, different preferences, and all kinds of good differences that exist in humans, right? So that's an important element, is that anytime that you're creating something, you have to think about how do I learn about the different people that are going to be involved in it, and how do I make sure that I build this so that I often say works for most people most of the time. You can't build something that's perfect for everybody, and it'd probably be not helpful for most people if you got it so that it was 100% error proof. But there are ways in which you can look at the population that's going to be involved in your process and try to figure out how do I make it work most of the time for most of the people, or you might decide that 80% is effective, because going to 95% effective would be painful, right? So 80% is good enough and keeps it loose enough that it works. And I think that's a key component, is appreciating how something works, who's going to be involved in it, and really bringing in that human element to appreciate that you want people to be able to work in this process, and they're not all the same.
I want to go back to something we talked about earlier in the discussion about um, testing, right? You said you're never going to install a process unless you know that it works. I think part of that, what you're describing, is learning, right? Learning whether or not something meets the need that we've identified within the organization. In your book, you talk about learning in rapid cycles. So iterative learning, iterative process improvement, building that muscle upon each other, right? Um, and I want to kind of get really practical there and just understand from your perspective, right? Like how should we think about rapidity, right? We've all been on projects that feel like they take 100 years to try to get something done, and whether that's scope or something else that we need to address. Regardless, I think in order to make significant change, it's all about that additive and incremental effect. So how would you suggest we approach rapid learning in the context of a specific timeline? Like, how long should these cycles take?
Well, so it depends. That's one of my favorite improvement terms from the science. It's really relative to
So
what you're doing,
scientific.
right? So most improvement projects. So let me separate an improvement project. I try, and this varies again depending on the situation, but I try to scale and plan an improvement project to take somewhere in the vicinity of 4 to 6 months. I sometimes that is a constraint in which people feel is unreasonable. But typically, my argument is that if I do it in 4 to 6 months, you've got to then commit resources to it and spend time on it, and actually carve out the ability for people to do this as part of their work. If I don't put a deadline, or if I allow it to be endless, or I say we want to get this done by a year, then often what ends up happening is it becomes a side project outside of people's daily work, of which it's always in competition. So the one of the primary reasons to pick something that requires like a certain degree of daily or weekly effort, and then planning a project and scaling it to a defined time frame, is then, as a leader, you've got to resource people to say, I want you to work X% of your time on this and get it done. I want to get results in a period of time, right? So that's scaling a project. Now, in terms of changes within that project, there's going to be a lot of different things that we try. Sometimes that's gathering information. Sometimes it's changing a way that we do something. And in doing that, I teach people how to use the Plan, Do, Study, Act cycle, which has been around for like 100 years. Walter Schuhart brought it to us. He worked at in AT&T, or one of the iterations of AT&T when it was Bell. And he basically was trying to boil down the scientific method to something that anybody could do at the point of where a process is, and do iterative cycles. And you see this cycle thing come up all over the place. So sometimes people will call them learning cycles, and there's actually something called the Kolb learning cycle, which is how the cycle of learning happens. And that's and there's different cycles that exist. But in the way that we teach improvement, we teach trying to figure out what's the smallest scale that you can take a change in order for you to try it and learn quickly. So I tend to shy away from saying rapid cycles, because people think they all have to be fast. It really, again, it depends. Sometimes I can do something on every claim. And so I could do 10 cycles in a day, because I might be able to get through 10 claims in a day and try out something different on each one, and each one is building on the other. Or there might be something that's going to take me 2 weeks, because it takes me 2 weeks to get enough of whatever I'm trying to change to see whether it has an effect or not. So the scale of those cycles change. But what's important, a key component of a PDSA cycle is at the front end, the plan part, is that you make a plan. You say, I think it's going to take X amount of time. Here are the learning questions I'm trying to figure out, and here are the predictions that I have. And then when that time is up, or when you've completed the cycle, you come back and you study and you compare the difference, right? And you go back and you say, well, here's what the questions I was trying to answer, and here are the answers. Here are the predictions I made, and here's what actually happened. And that reconciliation is where almost all the learning happens, right? And so one of the failures that that results in the experience that you've had and many people have is that people aren't testing enough. Right. So you often find that you say, well, tell me what you've tried. And people are like, oh, well, we met last week, and then we decided we'd meet again, and we were going to talk about this, and we needed more data. And I was like, so you haven't tried anything, right? You haven't tried to change anything. You haven't tried to go out and touch stuff. And do it, and so therefore no learning has occurred. You've been pontificating or having some interesting thought exercises, but nothing has And the best way to learn is to try to change something. I mean, just try that in your life, as you said, trying to get your son to plan out the treehouse, right? So getting them to do something requires effort, and then you learn things, right? So looking at people's PDSA cycles and how many they've done is one thing. The second thing I look at is, what have they tried? And typically what I'll find is that people have been trying the same change over and over again in almost exactly the same way with slight modifications. And sometimes they'll call it different things. They'll, I gave feedback to somebody. I did a training class. I sent them a PDF describing an article about this problem. All three of these are, the theory under them is that somebody needed information. There were just three different ways to deliver information, of which none of the three resulted in an outcome change. If that's one of the things that's supposed to happen at periodic points, is to go, well, we've tried, we had a theory that people needed information. We tried three different ways to give them information, and the outcome has not changed. So maybe information is not the problem, right? Maybe we should move on or do something else, right? So that often, the pausing and building in routines to learn from your data and learn from your PDSAs, and doing that at regular intervals, really helps you to generate learning, make sure you're making progress, and help you to stop things that aren't working and add things maybe that are new, that are different, that do work. And many times that's when a breakthrough happens, is when somebody's been working on the same ideas, and then they say, oh, but we haven't tried any of these other ideas, or we haven't worked on this other part of the process, or we haven't done this other thing. And then they do that, and they're like, oh, wait a second. And some new insight occurs, or there's a breakthrough.
Wow. A couple of final questions as we prepare to wrap here. First, Dave, curious, what's one belief about quality strategy that most people disagree with you on?
Well, I think the biggest thing that Well, there's a couple things. One is that that you have to make stuff easy in order for anybody to do it. There's a natural sort of tendency in, and maybe this isn't the greatest answer, but in our world, there's a desire for the easy button, right? I think it was Office Max or Office Depot came up with the easy button, and we have TED Talks, and people love TED Talks and like the short compactness. Everybody now is asking for ChatGPT to summarize stuff for them so they don't have to read, right? So there's an assumption that the only way things will actually happen is if we make them easy and digestible and simplified. And there's some truth to that in terms of the fact that I think we need to figure out ways in which we can reduce some of the friction and help people to do the right work in the right way. That said, changing organizations, leading and changing organizations to get results is not easy. Actually very few people know how to do it really, really well. And what I always tell people is that when you start really getting people into the mode of being able to deeply learn about the work that they have and figure out how do I change it, and I can see the impact, whether that's it makes my life easier or it gets better results for the goals that I'm trying to achieve, or I see that the people I serve, my clients and my patients, are having a better experience. That is like a game changer. That is super motivating. Engagement is super high. You feel proud about the work that you're doing and you want to do more of it, and you're willing to do really, really hard work. And I think right now, a good example, we've got the Winter Olympics. None of these people that are, skiing for medals or skating had an easy button. All of them had to work in very disciplined ways. And I think very few of them would tell you that they would ever do anything differently because of the fact that they, through their work and their dedication and their focus, they are deep experts in their field. They see the results of their progress. And when they really are successful, it excites them and motivates them. And actually, it probably less to do with the competition of the others. It's more of the competition with themselves of getting better at getting better.
Right. Yeah, such a great example with the Winter Olympics right now. If you could leave healthcare leaders with one mindset shift about quality that would immediately improve outcomes, what would it be?
Well, the biggest thing is to go back to the system and ask, do I have a process and a system of processes that is built to get the results that I want? And most people move to some other theory before they've confirmed that. And so I think that's an important piece. And one of the first steps I often do in any process is say, well, let's look at the data. Let's just look at your measures and see over time. Do you have a stable process? Is it built to get the result that you want? And then from there, you can make decisions about what to do. But as we talked about before, Rex, I think you want to be careful of immediately choosing a different direction without understanding your system at all. I think you want to be thoughtful about grabbing what's the latest thing that you saw scrolling down your screen on LinkedIn, or the bestseller that came out, or I'm cautiously optimistic about AI. I think there's a lot of potential there, but everything I read also says if we survive it, that it won't be something that is immediately changing tomorrow. Like there's a lot of things that have to happen, and you have to bring a lot of expertise to it. So I think that is an important piece. Is that and the other thing, and this is a hard one, is that leaders own the organization. They are the ones responsible for setting the vision, clarifying the mission. They're the ones that decide what the system will pursue and what gets funded and not funded. And so they own the major levers that can change the system in the direction it goes. If you're not getting the results that you want, you should really look in the mirror and say, well, how do I enable the people that work with me and for me to be able to do their best? So if I'm pointing away from me, and I'm pointing to other people and saying, I wish my people would be in compliance, or I wish my people would work harder, or I wish my people would, not work from home and come to the office because that's the only way I know how to manage, right? Like, there's a lot on leaders that it's really on us as organizational leaders to recognize that we are the ones that own and can make decisions about how to change the system, of which our people will be more than happy to dive in and try to figure out how to make their work really well and be better and get results. And they'll work together. They just need to have a lot of that friction that we enable or allow or don't change to be reduced.
Such great insights, 100%. And okay, last question: how can people find you and follow?
Well, the easiest way is my website is David M as in Michael Williams, PhD.com. And that is also the same way that you find me on something like LinkedIn. That's probably the most social place that I exist, and I always encourage people to reach out and connect. Know that I might actually ask you a question or something if you try to connect with me, but I welcome all people trying to connect in that way. And I post a good bit there in terms of things that I write on my blog, or things about the book, or upcoming programs that might be offered for the public and things there. So that's a good way to find me as well. And then also at the bottom of my website, there's a place if people want to sign up for my once a month newsletter, where I share articles and things that I've found and things related to improvement science and quality as an organizational strategy. And then, of course, you already showed the book. If you're interested in anything we're talking about, the qualities organizational strategy and its accompanying field guide, the QoS field guide, are both available on Amazon and other places, and a great way to learn more deeply about these methods.
It's a really good book. I read a lot, and most things I read are maybe shorter and a little quicker read, and you come out with a couple of nuggets and a little inspiration. This is a long read because it's so much good information. I find myself like underlining several things on every page. So it's really for people in our world, in our space. I think for most of all of our listeners, the book will resonate, right? So definitely consider it. And I follow Dave on LinkedIn, and Dave, your recent posts about chief quality officers and sort of the history of that, like very interesting, and I think would resonate with a lot of our listeners as well. So we'll tag you when we make these posts with the episode, and so people can find you on LinkedIn. Thanks so much for being on, Ryan. Thanks for co-hosting. This was a lot of fun. This is a great conversation, Dave. Lots of good information, good insights, and really appreciate you taking some time to be on with us.
Well, Rex, Ryan, thank you so much. I appreciate you inviting me to be part of this conversation, and I wish you the best with your work, with your clients, and in such an important industry.
You too. Thanks so much. Thanks, Ryan. Okay, thanks everyone.
Thanks.
We'll talk next time.